Is alternate nostril breathing a good practice for people with heart disease? For the answer, stay tuned. Alternate nostril breathing, a pranayama technique that's sometimes called nadi shodhana, is sometimes used in people with heart disease. The person who wrote in fact, is a teacher in the Dean Ornish program, which is a cardiac rehabilitation program and preventive medicine program as well, that's used for people with coronary artery disease, blockages in the arteries that feed the muscle of the heart, which when become constricted can lead to heart attacks and even sudden death. This teacher was kind of alarmed when she saw nadi shodhana being used because she worried that it was too heating a practice. And one of the things they're really trying to do in the Ornish program is bring down the heat, bring down the inflammation in people with heart disease. Now, from a yogic perspective, breathing through the left nostril, the Ida nadi, is related to cooling energy. Breathing through the right nostril, the Pingala nadi, is related to heating energy, kind of like yin and yang in Chinese medicine. And so alternate nostril breathing really isn't particularly a heating practice. Rather, it's a balancing practice. It's a balance of cooling and heating practices combined in one that makes it overall kind of neutral. So I wouldn't worry about alternate nostril breathing being inappropriate there. In what may be the very first case of yoga therapy being described in a Western medical journal, in 1948, there was a study published in a journal called Minnesota Medicine, where a doctor who had learned the practice from Paramahansa Yogananda of alternate nostril breathing taught it to patients with angina and other symptoms of heart disease. With remarkable success, people found that their angina decreased and they got better in other ways. So it does appear indeed that alternate nostril breathing can be a safe and effective practice for people with coronary artery disease. And of course, the Ornish program itself is the proof of this. They have kept safety data for their program, and the safety is very good. And of course, the efficacy of the program has been documented in very good scientific studies published in major medical journals. Now, one concern with alternate nostril breathing, if you do it in the traditional manner, which involves putting the fingers on the nose and holding the arm up, is that actually arm exercise can be a strain. So one thing that I often do when I teach people who are beginners, or I work with people who have things like bad arthritis or some kind of shoulder problem or something that prevents them from keeping the arm elevated for the practice, is to do what's known as mental nadi shodhana, mental alternate nostril breathing. And so to instruct that, I would simply say to the students to close their eyes, to breathe calmly in and out through the nose, and then to inhale, exhale, and the next time they inhale, imagine the breath coming in the left nostril. Then imagining it exiting the right nostril. Then in right, out left. Continuing this pattern. In left, out right, in right, out left. And at their own pace, continuing that practice for a few minutes at a time. Okay, so that is mental alternate nostril breathing. And most people find it to be a very calming and balancing practice. And it's easier than regular alternate nostril breathing, but I find it to be quite effective. And I have taught this to many beginners who also seem to be able to do it safely and to enjoy the practice. In any case, I hope this information is helpful to you, and I wish you luck. Take good care. Namaste.